Hi, and welcome back. This is Lupita Martinez, and I'm a licensed marriage and family therapist working here for the Peninsula Center for Children and Families at Rolling Hills Estates. This week's segment is actually not going to be quite a fun fact. However, it's a very important fact that needs to be addressed, especially due to the recent buzz that's been going around social media. Suicide is what I'm talking about. There's a huge stigma tied to suicide, and not many will admit to previous suicide attempts due to feeling ashamed, due to fear of possibly being treated differently, or they prefer not to speak about such a dark time in their lives. However, now more than ever, it's important to bring up the conversation and talk about suicide, its prevalence, and possible warning signs in order to bring up the conversation with friends and family members. The most common way of treating underlying issues associated with suicide are talk therapy, medication, or a combination of the two. Suicide is the second leading cause of death for college and school-aged individuals. These are children, adolescents, and young adults ranging from the ages of 10 to 24 years of age. According to the National Institute of Mental Health, 4 out of 5 individuals who have completed suicide will demonstrate warning signs months before. What this means is that it is important to recognize these warning signs in order to intervene before it's too late. These warning signs that I speak of can include, but are not limited to, the following. These can be individuals that are talking about wanting to die or mentioning it very casually or even joking about wanting to die or kill themselves. These individuals may even mention feeling empty or hopeless or having no reason to live, and others might even mention that they feel like a burden to others. You may even notice that they're using more drugs or maybe drinking a little bit more than usual and engaging in a lot more risky behavior, such as driving fast or engaging in very illegal type situations. They might withdraw from families and friends, and they may even change their sleeping and eating habits. You may even notice that they're more irritable or anxious or have very extreme mood swings going from very, very sad to very calm and happy. Others may mention feeling trapped or not feeling like there is a solution to their problem. Or you may see them drawing or writing about death, having gruesome or morbid thoughts and images. You may notice that they have a difficult time making friends, maintaining relationships, or maybe experiencing bullying, whether it's at school or in their neighborhood. If these warning signs apply to you or someone you know, please get help as soon as possible, especially if this behavior is new or has increased recently. One resource is the National Suicide Prevention Lifeline. You can contact them at 1-800-273-TALK. They are available 24/7. If you would like to learn more or schedule an appointment for talk therapy, contact us here at Peninsula Center for Children and Families in Rolling Hills Estates. And thanks for sticking around and watching this week's segment on suicide. To learn more interesting facts, stay tuned for next week's segment. See you then.